Hi, I am Sam Manalo and I am back here at CSA Medical Aesthetics. A month ago, I just had my nose fillers done, and for today, I'll be having my jawline enhancement. So don't forget to like and subscribe.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's welcome Sam Manalo.
Hello po.
So we did a non-surgical nose enhancement before. So how was it, Sam? So far?
Yung pinaka-tumatak sa akin is painless yung buong procedure.
Awesome.
Wala akong na-feel.
Right, yeah. Plus, the result was natural, you know.
Natural.
And I was mentioning to Sam that it's like if you've done something, you're not kind of like embarrassed to go out and people are like, you've done something. There you go. So this is like a non-surgical nose enhancement, just improving the dimensions of the nose, the profile of the nose. Okay, so looking at the side view, we still have that good angle, frontonasal angle, and that nasolabial angle. Now, we also want to do like a follow-up of this one. We still want to do the mesotherapy to reduce the fat tissues on the nose tip as well as the alars. For today, we wanted to do like a so-called masculine type of like a jawline area, okay? Sam is still young, early 20s, right? So I was mentioning to Sam that you still have baby fats.
Yeah.
Okay, so this is like for young ones nowadays, it's not an anti-aging treatment, of course, but it's something to enhance or highlight those attractive features of their face, especially men, the jawline area, right? So yan yung mga may tinatawag na chisel jawline, sculpted jaw, diba? Snatched jaw, yan, yung mga masculine, yun, square-shaped jaw, right? For women kasi, what we want to highlight will be the mid-face area. So that's why we want a high cheekbone, we do like a blush on our cheeks, right? Then women, we want a narrower lower third of the face. So pagdating sa jawline ng babae dito, narrower, slimmer. But for men, it's different. For men, it's more of the jawline that they wanna kind of highlight, okay? And yung width of your mid-face plus yung width ng lower face, the bigonial width, should be aligned or in a horizontal, rather vertical line. Yan. Kaya nga square shape. Now, I was assessing the lower part of the face of Sam, okay? I was explaining to Sam the right side here, kind of like there's a dominance, okay? Kind of the soft tissues are prominent here on this side, right side, less dun sa kanyang left side. So, we have a so-called inherent asymmetry of the face. So, one side can have or maybe more prominent than the other side, or kind of in terms of the volume, more volume than the other side. Or for older people, one side can be saggier than the other side. So, this one is your dominant side. And we even ask you, do you chew on this side most of the time?
Yeah.
Yes. So the chewing muscles there too. So they're kind of like stronger here plus bigger here because that is the side that you use. It's like exercising the muscle. So which side do you exercise most of the time? So siya yung mas prominent, right? So there's a dominance of this side. And I was palpating or touching the angle of the mandible, yung jaw area here. So, the bone is kind of like inwards. So, we have some people with what we call mandibular hypoplasia. So, it's like a bit hidden inside, but you have a lot of soft tissues. So, yung skin mo and then yung bone mo in between. Maraming in between. So, yung in between, andun na sila muscles, and andun na rin sila fat tissues. We have superficial fat, we have deep fat, and plus this area, meron ding parotid gland. Okay? So, of course, we want to make the face symmetrical and at the same time, bring out the jawline. Okay, ano bang klaseng jawline, Sam? Yung, at your age, yung, ano ba yung young ones like you that they really want to achieve right now? Something is still simple lang, yung subtle lang, na medyo meron lang contour. Define, yan. Just a defined jawline. We're not naman achieving those, yung mga kikita mo sa billboard na mga talagang sobrang, yan. So, we just want it defined and balanced, harmonious to the face. Okay, so what kind of procedure, what treatment, we'll show you when CSA Medical Aesthetics return. And we're back. So, our goal for Salm is to highlight the lower third of the face. So, the jawline area, we want a well-defined jawline, okay? So, I'll start with doing the sculpting of the angle of the mandible here. Okay, Sam? So, this part of your mandible, okay? So, the ramus and the body, you're gonna bring it out, okay? It's like a letter L, right? Now, for that one, I'll be needing my Hygi Prime Hyaluronic Dermal Filler. So, we wanna build something, we wanna restore also volume, and at the same time, kind of highlight this angle of the mandible. So, this part here, now, for men, whenever we do a jawline definition, we locate for the angle of the mandible. And I've mentioned a while ago that Sam's mandible is kind of like hypoplastic. It's inward. So, we want to bring this out, okay? And we inject the filler in front of the angle of the mandible. So, Sam has some acne marks on the lower third of the face. So, next time we'll also be doing treatment for that one, okay? So, this is the angle of the mandible. So, I have my hyaluronic filler here, okay? And I'll inject onto the bone, okay? So, onto the bone. So, for doctors, we avoid the so-called antegonal notch. It's in here because that's where your facial artery is. Then, I still do some aspiration there. Then, after this one, I'll be infusing half of my syringe onto the bone. So, it's a little bit like some discomfort sound because I have to really touch a bit the bone there. And then I'll infuse already 0.5 ml of my dermal filler here. Now, after I inject a 0.5 ml of my dermal filler here, I'll be doing a combination procedure. So, this is needle method. Then I'll also do the so-called cannula method. So, this is delivering 0.5 ml in front of the angle of the mandible. So, after this, pull out. And then, I'll make an entry point. So, delivering it here on the mandibular ramus. So, my entry point is here. I'll be directing it towards the angle. So, I'm using a gauge 22 cannula here and direct it towards that. So, I'll glide it. Now, this part here, expect some resistance because this is like an area whereby we had some acne, right, Sam? So, some of the acne scars. Okay, so some fibrosis there. Then, we're just gonna reach that angle over there. And then, we can already push some of our product material. So, this is a 1 ml syringe hyaluronic substance. So, we want to create the so-called angle of the mandible. So, I'm just gonna do a fanning technique here. So, delivering the entire 1 syringe here. Okay, filling that in. Okay, so I'll be doing a combination procedure for you. Okay, so we're starting with the so-called hyaluronic substance here. Okay, then after this, I want to target the fat tissue. I'll be doing a fat reduction technique with my old therapy. Okay, so we want to reduce those prominent fatty tissues. We want to create a well-contoured face, well-defined jawline as well. So delivering the remaining one of this product here, going to the posterior aspect of the face on the lower third. Okay, there you go. So I've done the filler there. Okay, now I can do my Ultera. I have an Ultera device there. So since some has a dominance of the right side of the face, I'll be giving more shots here. And I'll be using my transducer 4.5 millimeter. Then after that, I'll combine with the 3.0 millimeter to target the fat tissues, okay? So this has no needle, okay? This is just an ultrasound therapy device. So I'll be delivering initially like 30 to 60 shots in this area. How is that sound? Okay lang? Okay. So there's a normal sensation of like a pricking or like some tiny needles piercing the tissues. That's normal, okay? So this is just delivering this heat device. Well, it's ultrasonic energy into the fat tissues, okay? So we have 3 transducers of this. We have the 3.0, 1.5, and this one I'm using 4.5. So I want to reach this mass layer, mass plus the fat layers. You want to reduce that, okay? So we want to reduce the fatty tissues in this part, okay? And later on, I'll combine it with my PDO threads, protein threads, to also tighten and firm the skin. That's also help the skin pores and some of the acne marks. It will improve also your skin quality, apart from tightening and firming the skin and stimulating collagen. Plus, my PDO threads will help in contouring the jawline, okay? So for people who are trying to lose weight and some of the fats are already going away, to prevent the sagginess of the tissues, I recommend doing your PDO thread lifting. So I'll just deliver some 30 shots initially here, okay? So with Ulthera, you can deliver as many shots you can, okay, in one session. Now take note that there are Ulthera devices that came out that are not authentic, so just go to those providers with authentic Ulthera devices, because this is the only machine, like an ultrasound therapy machine, that has this deep sea technology, whereby we can visualize the anatomical tissue layers and we can be precise and accurate in delivering the ultrasonic energy. So I'm already increasing it into 40 shots, okay? And last 2. Then after this, we'll just clean the area again. We'll disinfect. Okay. So we'll disinfect the area. You're still good? Yeah. I'm already seeing the L shape. Okay. So I'll do the so-called thread lift. Okay. I'll be using my PDO protein threads, polydioxanone. These are polymers of dioxanone, okay? And these are like absorbable suture threads. And these types of threads have been used in medicine, surgery for a long time, more than 100 years. So it's a medical and surgical device. Now it's used in aesthetic, cosmetic procedures. So it's important that we clean the area again, okay? If we have pain freeze, we can use our pain freeze to numb the skin. Okay, if we have a pain freeze there, let's numb the area, okay? So if I have this, I can spray a cold anesthetics there. There you go. To numb the area again. And then I'm just gonna put on my new gloves again. So I'm finishing up with the right side. Another concern, by the way, of Sam is like the under chin, right, Sam?
Yeah.
So whenever he looks down, he bends down, he's noticing the chin, under chin area bulges. So some of the protein threads that I have here, some pricks lang Sam. Okay. I'll be making a so-called mesh technique here. Okay. So, and then I'll do the vertical pattern there. So this will also benefit the skin of Sam, because he has some acne marks. Okay. So last time we did the PDO nose threads. Okay, last one. Then we're gonna shift to the, okay, there you go. Shift to a dermal filler actually in the deep nasolabial triangle. Sorry for that sound. I know those are needles. Okay, I understand. You have like protein threads, PDO threads in your nose, so this kind of threads are not new to you. Then we'll just inject also in the nasolabial triangle here, because I noticed there's a deepening there, because I wanted the cheek area of Sam to be uplifted. Okay, just a tiny like needle here. Okay, I'll press here and then glide onto the bone, just like the first injection that I did on the angle of the mandible. Then just aspirate, and then infuse 0.3. I'll just be giving 0.3 here, just to correct your sunken part here. and deliver that 0.3 almost. There you go. Okay. So to correct also the problem of the submental area, I know, right? You're doing a lot of procedures now. Okay. Now this part here, we can also do Ulthera. Okay, I'll just continue with the submental region. I'll do Ulthera, and then after that, I'll do the threads. You're good. You're in great hands. You're doing a great job here. Okay, so shift to the 3.0 millimeter. I want to target to subcutaneous fat layer. Okay, I'm already seeing the shape of the jaw. Okay. So I'm using again my Ulthera device. Okay, no needle here. Okay, so this one here. So I'm using my 3.0 millimeter there. So I'm seeing the subcutaneous fat layer there. That's a good thing with the Ulthera. You can see what's inside. How's that? So far so good, right? No needles. Okay. I love my Ulthera because, you know, I can do this anytime. No downtime for this one. If I want to contour, if I want to like reduce fats, tighten my skin, firm my skin, lift my skin, I can use my Ulthera any time of the day. Even without lidocaine, it's tolerable. I can tolerate this because some people are saying, oh, Ulthera is painful. Look at some. But the needles, right? You felt the needles. I do understand that. But this one, you're good. So I'm going to deliver 30 shots here too. So a while ago, like in the buccal fat area and the jowl fat area, I delivered 30 shots. And I can add a little bit more later on. Okay? So for the purpose of just demonstrating what we're doing here to help you develop or achieve that well-defined jawline. So Sam is still young, so still gonna develop better structures of his face, okay? So this is like helping you achieve that. Well, nowadays, some they're saying that the earlier you start doing treatment, the better. It's now the so-called pre-juvenation. Don't wait for your face to become older, that it's too late to reverse the aging process. The younger you start, the better, because you can maintain that look if you're doing something like this kinds of pre-juvenation treatments. So I'm delivering last 4 shots here. Then I'll need my protein threads again. We have the gauge 29, 30 millimeter to 40 millimeter, a lot better. Even your mono threads will be fine. Okay. They were saying some no pain, no gain. You're good. Now I'll do the under chin. I want to reduce the fats here, okay? We also have a treatment we call like lipolytic injections or mesofat dissolve. So cases like this, I also combine. I combine with my fat dissolve. So I'll change my gloves again, okay? So let's disinfect. So if I do lipolytic, I start with mesolipolytic injections and then do the Ulthera. But if I do threads, I'll start with my Ulthera, then my PDO threads, my protein threads. Because with your Ulthera, you can actually reduce fats. You can target the subcutaneous fat layers, so disinfect. And then your protein threads, your polydioxanone polymers PDO, okay, can stimulate tightening and firming so that your skin will not become loose or saggy, okay? So there will be no problem of like loose skin. So we're improving the skin elasticity, okay? So again, cold, something cold to help some here, okay? Some, sorry. You can do this. You've done the other one a while ago. So I'll just inject 5 here, okay, no sharp needle. 1, 2, 3, 4. So there's a pattern that you can follow. So this is like a parallel ladder type pattern. Okay, on the other side, disinfect again, okay. Whew, that's a horizontal pattern. There's also a vertical pattern. So others you'll see doing vertical, you can do that too. And this one is just delivering it in the submental fat tissue subcutaneous layer. So we want to also reduce the fats and at the same time tighten and firm the skin and make sure that some doesn't have that development of saggy under chin or double chin. Okay, you did it, hooray! So after this side, I'll be proceeding with the left side area. Okay, that's right. 1, 2, 3, 4. Last one. And we've done the video threads. We completed the jawline definition treatment using combinations, filler, threads, Ultera. We'll show the result to some when CSA Medical Aesthetics return. And we're back, so let's show the result to some. Here's the mirror after that multiple needle injections on your face together with the Ultera. We did the combination filler plus PDO threads plus Ultera, and later on we'll still do some meso fat dissolve, okay, to improve the contour to really deliver that optimal outcome. Although right now it's still kind of, you know, post injection, we have some redness and some swelling there, that's expected, but like 2 weeks, 4 weeks, 12 weeks, 3 months, 6 months, we'll be noticing big improvements. How was it, Sam? So far, so good. Yeah, this one is kind of like he felt the needles, unlike the non-surgical nose enhancement. Yeah, but this one was multiple, so it's kind of like...
mas marami po kasi siya ngayon.
Right. We did a lot today since we're working on the lower third of the face. Of course, the lower third, we're targeting tissues here. We are improving the, you know, the deep fat and superficial fat pads, kind of like the how thick they are. We kind of want them to be reduced, diba? Especially on the right side. Plus, we were bringing out the contour of the angle of the mandible. We want it to be like the L-shaped type, and we'll still wait for the effect of the Ultera. Plus, later on, we'll do some fat dissolve, okay? Once we have reduced the fats, we're gonna bring out that jawline contour, right? Yeah. Okay, you're right, yeah, kasi multiple nga naman yung procedures natin ngayon, so somehow, you felt some of the pins, the needles there, but so far tolerable, right? You were able to tolerate it. So, as they say, no pain, no gain, okay? Yeah, thank you so much, okay? We even work on the under chin because we also want to prevent any development of submental bulges there, because some, whenever he likes look down or bends his neck, so he's noticing already the bulge there. So while it's still like that, we want to prevent it already. So prevention is already the thing right now, or prejuvenation. While you are in your 20s, you want to maintain your look while you were 20s, okay? So this is something we can already, like, you know, share with you guys. Don't wait for your face to deteriorate, okay? To degenerate, because this is prejuvenation. Because the others were saying, "Uy, he's only 20s, why is he doing something like that?" Okay? And for young ones, it's enhancement. It's, you know, you highlight those attractive features of your face. And yan. See, Sam, actually, I love the chin shape also. Okay? I didn't do anything on his chin anymore. It's just the mandible here. Actually, yung mandible hypoplasia mo, you were born with it, eh.
Yeah.
Hindi mo kasalanan yun. Okay? So it's something we inherit. It's in the genes already, okay? So, Sam, thank you so much. Is there like anything you want to share with the audience?
I mean, I'm just so thankful.
Yeah, of course. Welcome. Opo.
Ayun.
Yeah.
Yun lang po.
And we pray for a successful career for Sam here. You're into singing. Yan. Yan po ang blessing sa kanya. Gift ni Lord sa kanya. Yung talent niya in singing. Kasi sumikat ka na sa... Saan ko na kasi narinig si Sam? Narinig ko na si Sam eh. Diba? Like, on Facebook, I see you, your group. And then on like Instagram. And then in radio. So we hear you on radio.
Din po
yeah, you do some guesting. You wanna invite some a little bit?
Sige po.
Yeah, just a little bit.
Ayun, follow niyo po yung band ko. It's called Barabas. BARABBAS. PH yung sa Facebook, Barabas PH. Then the rest po ng mga social medias namin, Barabas lang po. Ayun. Abang lang po kayo ng mga upcoming gigs namin. And maglalabasin po kami ng bagong single din, so abangan niyo po.
Yay! There you go. Let's support our own Filipino artists, especially our new ones. to Sam here, praying for a successful career.
Thank you po.
God bless you always. So, if you have any questions, you may email us at csaskinclinic@yahoo.com, Instagram CSA Medical Aesthetics, FB page CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other videos. Some had the previous non-surgical nose enhancement. So, God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetic.
Nag-ibang ikot ng mundo dahil sa'yo. O irog ka, daran-dan-dan-dararo. O irog ka, ngiti ko'y abot langit pag ika'y nasa akin.